know, in the last several weeks, we've been facing a pandemic, and we're being tasked with reinventing and how we deliver public health. Today, I'm joined with some important partners in that effort, and they'll introduce themselves when they come up. City Council President Matt McLaughlin, also a veteran. I thank him for his service. The Executive Director of the City's Health and Human Services Department, Douglas Kress. Dr. Asad Sayad, the CEO of the Cambridge Health Alliance. Charles Gagnon, President and CEO of Volunteers of America in Massachusetts. And Sumit Kumar Nikpal, the CEO and co-founder of Cherish Health. For the last several weeks, we've separated ourselves from one another, closed up much of our society because left unchecked, the coronavirus would overwhelm us. And that's what we're working furiously to change. We are working tirelessly to interrupt the transmission of the virus from person to person. That's evident by today's announcement also of the mandatory mask requirement for anyone age 2 or older in all indoor and outdoor public spaces. We're trying to get our arms around the spread of this disease and make sure we can care for everyone who contracts it. Today, the people who have joined me here will be talking about the important steps we've been taking in that direction. Yet part of what the coronavirus epidemic is doing is exposing every gap in our system. The people it's hitting the hardest are the most vulnerable and those who are on the outside looking in. It's forcing us to take a hard look at inequities we've ignored for far too long. Too many people can't access health care. Too many people are grappling with hunger. Too many people have tenuous housing and insufficient income. So let's be clear, this isn't just a health crisis. It's a stress test on our entire system. And much of it, I think we can agree, is broken. We talk a lot about getting back to normal, but normal wasn't working for large sections of our society. We absolutely must get back to a more social and connected world, but when we do, we've got to make sure we're taking better care of each other. So in recent weeks, we've worked collectively to address people with immediate needs. I want to thank our council president and the school department, the school committee, and our other local officials and advocates. We've distributed in Somerville more than 4,000 face masks to senior housing facilities. We've required those residences to submit new site plans and establish stringent safety precautions. We have provided more than 21,000 meals to area families in need. We have launched a fund to give local small businesses up to $10,000 in aid. We've established a charitable community fund for people in need that raised more than $100,000 so far. And we've set up a system with Comcast where approximately 450 families can get free internet so that their children can continue to be educated at home. And we've also distributed more than 1,200 interactive devices so children can connect with their teachers. We're getting rent assistance to residents, helping them navigate the unemployment system and connecting them with mental health counseling, because we know people are suffering through incredible mental and emotional duress because of the isolation and stress of the situation. We have transformed our city information service into a de facto social services clearinghouse to make sure everyone can get the help they need. So in that spirit, what we're here to announce today is a COVID-19 testing system that everybody in our community can access, and a home health monitoring system that can catch when cases among our most vulnerable residents take a turn that requires immediate medical attention. So in partnership with the Cambridge Health Alliance, we are going to extend Drive Up to everyone in our community at their mobile testing site at the Somerville Hospital campus. No matter who you are or what kind of health coverage you have, you will be able to schedule a free test at the Somerville Hospital campus. We also will be improving that system so that people can actually just walk or take their bike up to the site to be tested. But equally as important, we will be extending testing to a satellite location in East Somerville, which is at the heart of our highest concentration of lower income residents. We are bringing testing to where the people with the greatest need live. Dr. Asad from Cambridge Health Alliance will give full details about how the program operates, but I want to stress, and what I really want to stress is that we cannot get ahead of this virus unless everybody, and I mean everybody, is tested. We've heard over and over again, we need 3 things to get our arms around this crisis: testing, testing, and more testing. And at the national level, it has been an abysmal failure, and here in the state, we're barely catching up. COVID-19 does not care about your race, your income level, or your citizenship status. And if we leave pockets of our society underserved, it will take root there and spread to everyone else. There is a silent transmission that is ongoing, and we need to attack it. Ultimately, privilege is no protection from this virus. Also today, in conjunction with Cherish Health, we are announcing a home health monitoring system that will allow those who have tested positive for coronavirus but who do not yet have severe symptoms to stay at home. One of the scariest aspects of this disease is it creeps up on people. They slowly lose their breath and may not realize how critical their situation is. The virus can actually trick patients with serious cases into delaying necessary medical attention. By keeping real track of a patient's vitals, medical professionals can care for people while they remain at home, freeing up precious hospital beds and resources for those whose symptoms become life-threatening. So they'll be able to monitor heart rate, pulse, respiratory rate, blood oxygenation level, and temperature. And they'll be able to connect you to a command center that has telehealth. We're looking to enable continuity of care so that people who require an elevated level of care can receive it in the moment their condition takes a turn for the worse. And like with every disease, catching coronavirus early will save lives. We will be piloting this program at the Massachusetts Bay Veterans Center here in Somerville. I want to welcome Anthony, who's the key guy at the center, and thank all the veterans there for their service and your service. That facility plays a vital role caring for veterans who find themselves in the most dire of circumstances, whether it be homelessness, addiction, or in this case, illness. And we've all heard the chilling stories and reports about mass deaths at veterans facilities in other parts of our state, and we are all committed to make sure that is not repeated here. Like our veterans, we're embracing the creed that no one gets left behind. We are building out a response to this disease that makes sure we account for everyone. Anything less than that will be a dereliction of our public trust. That really must be our guiding star, not just at this time, but in the days and the weeks and the months ahead, in the years that are before us, after we get past this crisis and in the other side of this epidemic. We are not, folks, just in a fight to save lives. We have been given a wake-up call that our society has too many people in serious need, and it makes us all more vulnerable in a moment of crisis like this. At this time, I'll welcome up CEO of the Cambridge Health Alliance, Dr. Asad Sayad.
Thank you, Mr. Mayor. Good morning, everybody. And thanks to the City of Somerville and the Department of Public Health and all our partners. As Mr. Mayor said, testing is absolutely critical in our ability to really mitigate and contain this unprecedented situation. Mr. Mayor and I stood together about 5 weeks ago at the Crown Street Testing Center when we started that day. And the plan on that day was to start with the Cambridge Health Alliance patients and quickly expand to the community. Unfortunately, due to actual testing material shortage, we were not able to expand in that direction. And we limited the testing to Cambridge Health Alliance patients, and not only that, patients that were triaged and they were symptomatic. Now, as Mr. Mayor said, at the time, that was the best we could do. But in order to truly get to the other side of this really terrible situation, we have to widely test. And that was our plan. Fortunately, last week, through a lot of assistance from the Department of Public Health, Mass Department of Public Health, we were able to receive 3,500 swabs and assurances that there is more to come. With that assurance, quickly we moved into expanding and returning to our previous and original plan to test throughout the community Cambridge Health Alliance and non-Cambridge Health Alliance patients, positive and non-symptomatic patients, throughout the community, and not only in Somerville, but outside our Somerville, throughout our footprint. To that end, the first step was to expand our ability to test at the Somerville site, which is on Crown Street, at the tent by the Somerville Hospital, to include all patients in this community. One thing we have to make sure that a lot of these patients are not Cambridge Health Alliance patients, and we have no records of them. And logistically, it is very important to call ahead of time and be pre-registered and get all your demographic information so we find out who you are and we can get the test back to you when it comes back and make sure that the right test goes to the right patient. If we don't do that ahead of time, the site is going to be extremely congested and there's going to be a lot of lines and people are not going to be very happy. So please call the number ahead of time. It takes about 3 or 4 minutes to get pre-registered. You are in the computer in the system, and when you show up on site, we'll make sure we identify that you're the right person. You get tested, you get appropriate instructions in multiple languages, and this way we will be able to track you once we have the results after the fact. That's number one. Number two, that's absolutely important, is we don't differentiate who's going to show up. Anybody can show up. Anybody regardless of their ability to pay, of their insurance status, of their background, of their immigration status. This is not the purpose in here, is to find out, is to get the information just to find out who the person is. The only reason we're getting the information is so we can track and appropriately care for you if you have any issues. And last but not least, it is very important also to make sure that we practice what we've heard all the time. Social distancing is absolutely critical. The test, although it's reliable, it still has false positives and false negatives. And you have to remember that even if you're tested negative, you still have to act as if you were positive. I said that 5 weeks ago. One of the things we have to remember, all of us, is we always have to behave as if we are positive, so we don't transmit it to the next person and so we don't get it from the next person. That's absolutely critical. It also, I'm very happy to say that with the partnership with Cherish, that will also help us to keep a lot of patients at home appropriately monitored and triaged in a way that we could maximize the utilization of the resources that are precious that we have in our healthcare community. So let me stop here and ask Doug to continue, and I'm happy to answer any questions later on. Thank you.
Good morning. I'm Doug Kress, Director of Health and Human Services for the City of Somerville. First, I want to say thank you to the Mayor and to Dr. Asep for their leadership on this effort. The testing will be open to all Somerville residents, regardless of insurance, immigration status, and our dedicated staff at HHS, our dedicated nurses, will continue to follow up throughout the process, including up through isolation if any individual or patient would need that. This is to ensure that our patients can talk to medical professionals and get the help that they need. A team of staff are also deployed to support our residents, offering them a variety of services. As the Mayor mentioned, we already offer them a variety of services, including access to food, access to other supplies that they might need, counseling, and also, for those who test positive, safe isolation areas. This will also help connect them to other services that the city is offering, whether that be around employment and or housing supports. HHS is working with the support of our multilingual team from the Health and Human Services Department, as well as our Immigrant Services Unit within our emergency response structure to assist our residents with safe isolation and quarantine. To help us understand the coverage of how this virus has gone, HHS will continue our efforts to identify individuals and the numbers of all the people that they may have been in contact with so that we can do our contact tracing prior to 4 or 5 days from them being tested. We are working with our partners at the state and the partners in health who will help reach out to all these individuals to inform them of their potential exposure. Again, I want to thank the mayor for his leadership on this, and we're available to answer any questions you may have. But I first want to hand it over to our president of our council, Matt McLaughlin.
Hey everyone, Matt McLaughlin, City Council President and Ward 1 City Councilor for East Somerville, which, as Mayor Curtatone mentioned, has a lot of vulnerable populations there, and I want to just come up and express my support for Mayor Curtatone and the effort that he's provided this entire city. We're the most densely populated city in New England, and we have fortunately been on top of this from the beginning, so I think it was because of his proactive efforts that made us in a much better situation than we could have been. So as I mentioned, we have a number of vulnerable populations in the city, one of those groups being veterans, and I'm very glad as a veteran that we're looking out for that population specifically, as well as other vulnerable populations. And I just want to turn it over to Cherish Health so they can explain some of the programs that we're going to be doing to address veteran concerns. Thank you.
Thank you, everybody. It was just about 10 weeks ago when we had launched our biosensor patch. It looks like this. It's called Cherish Serenity. Just as the lockdowns had started, as we started understanding the virus, we were shocked to realize that we might as well have purpose-built this little device for this virus to diagnose its symptoms. And so we sort of rolled up our sleeves and went to work, working with clinicians around the country, all the way into the UK, to start understanding, well, what should we measure? What should we do when we measure the things that give us some indication of what the symptoms are? And then try to determine how to actually help people get the care they need where they live, take some of the pressure off hospitals and emergency rooms. We cannot thank you enough, Mayor, for your leadership in giving us a platform and opportunity to actually put this in our own backyard, because we're based right down the street in Cambridge. Also, cannot thank you, Dr. Saya and your team, Laura Council, Janice John, Michael Sage, Glover Taylor, Elizabeth Farrar, Anthony Ream. They have been amazing to work with at Cambridge Health Alliance to take something that was just an idea about 10 weeks ago, and as a team, work through all the details to the point where people are now wearing this and receiving some of the benefits and getting some of the peace of mind that we've just heard the mayor and others speak about. I also can't thank enough Donato Tremuto, the founder, CEO of Healthy Villages, for his generous support to sponsor us to provide these biosensors to Mass Bay Veterans Home, where we expect that these will help some of the veterans who have given us everything that they have to find some peace of mind knowing that they are being watched over as they reside there. I'll leave the rest for questions later. Thank you very much.
Good morning, everyone. My name is Charles Ganyu. I'm the Chief Executive Officer and President of Volunteers of America, Massachusetts. And I also want to thank Mayor Curtatone for his generous partnership over the years and this warm invitation today. It means a lot to us. And Volunteers of America, Massachusetts, is the owner and operator of the Mass Bay Veterans Center. I know the mayor had recommended our capable director, Anthony Joseph, and he leads a team that cares for the most fragile veterans in our community. And Volunteers of America, that's consistent with our mission. Our mission is to help people in need, help the disenfranchised, help people that have complicated health conditions, and provide them the supports so they can reach self-sufficiency. We have a firm belief that every individual can reach their full potential, and that includes our homeless veterans at the Mass Bay Veterans Center. This new and exciting monitoring and kind of broadening access for health care to our veterans is exactly what we need at this time. And I really am excited about being part of this partnership. I want to thank, of course, the mayor and the City of Somerville. I want to thank Sumit for Cherish Health and his innovation and brilliance. Healthy Villages, Donato Trumato is really financing this initiative. It's very important that we make the investments at the right place at the right time right now. The Cambridge Health Alliance, Dr. Assad, I think one of the most progressive leading hospitals and healthcare systems in the state. And finally, our Volunteers America Massachusetts team. It's really important that we get this right. I share the same concern with the mayor, where there's been a lot of challenges across the state with veterans community. I got so concerned, we reached out, the mayor gave us a call. It was just amazing. He goes, "What can I do, Charles? How can the City of Somerville be helpful? What kind of assistance you need? What does Anthony and his folks want?" And he did it. That's awesome. And, you know, it's really important that our model is a holistic model. So the veterans are not just homeless. Now they're receiving care for mental health, substance use disorders, food security, workforce development. Ultimately, we want to secure and place folks in permanent, safe housing. It's really important that our veterans that gave so much to us and really protected our freedoms and our liberties. So now it's time for us, Volunteers America Massachusetts, Cherish Villages, the City of Somerville, Cambridge Health Alliance. We have to give back to these veterans and hope that we can improve their health conditions and they can live their lives fully and independently. And lastly, I just want to mention, we have some good news. Anthony and his team have secured 6 new units of permanent housing for veterans over in the Mass Bay Veterans Center. Excellent. So we're going to have 6 new veterans coming to the Mass Bay Veterans Center, and we want to welcome them to the City of Somerville and our community. So we're really getting good work done in a very trying time. And lastly, Mr. Mayor, you may recall that you and your mother came by the Mass Bay Veterans Center and made a spaghetti dinner, and I heard you made an offer again to come by. So when things settle down, we'd love to have the mayor and your mom. The door will be open. We'll put the red carpet down. We'll have some fellowship time, and I've heard a lot about this tasty spaghetti dinner. So I'm really excited that you and your family can come by. And I just wish for the mayor's strong leadership to continue. You're really getting it done. And we hope and pray for all the residents of Somerville, Massachusetts, and the world that we get through this. So be well and be safe.
Thanks, Charles. I look forward to that as well, and even having a dinner with my mom, like many folks have put that aside with their elder family members. So we have time for some questions here, follow-up, if there are any from the media. Julia?
I don't know about the City of Somerville, but I can tell you at the Cambridge Health Alliance, we have had almost 6,000 people tested in various places, and at the actual tent itself, almost 2,000 so far. Yes, we could use all the donations that we can get. We always have a need for personal protective equipment. At one point, about maybe 3 or 4 weeks ago, we went through almost 12,000 gowns in one day. Our size hospital, 12,000 gowns in one day. Since then, we put together a very thoughtful process of cleansing and sanitizing and reusing gowns. So we don't use the same gowns all the time. We recycle them and cleanse them, and a lot of organizations are doing this. And the challenge at the time was to cut down the burn rate by 90%, and we were able to accomplish this. But we're still at that rate now. We're busier, going through to almost 2,000 gowns a day, and countless number of masks and gloves and everything else. So absolutely, we need that. On the vent side, we have plenty of ventilators for multiple reasons. Under normal circumstances, as you know, we have 2 acute intensive care units, one at Cambridge, one at Everett. Under normal circumstances, we have 13 beds and on average of 2.6 ventilated patients a day. For the last 3.5 weeks, we expanded the units and opened additional intensive care units at our operating rooms called the PACUs area. And we expanded our ability to close to 30 beds. That's more than 2.5 times the size. And on average, we run about 25 intensive care patients, and on hand, we have 36 ventilators. So we have enough ventilators. Additionally, I want to recognize the Boston Teaching Hospitals, particularly our partner, Beth Israel Deaconess Medical Center and BILH. We have transferred to them, because we are in a hot zone and we're seeing a lot of sick patients. We've transferred to them over 60 patients from the intensive care unit and the inpatient services, and almost 70 patients from the emergency department. Those patients would otherwise be admitted to the hospital and requiring intensive care. So with all these modalities of intervention, we're very busy. We're one of the busiest, actually the busiest small and medium-sized hospital in the state. And we are busier than some of the larger hospitals, but with the support, we were able to keep our doors open.
Can be tested, per day at these sites if they pre-register.
So until this past week, our supplies we were really babying and protecting our supplies, and we were testing about 100 to 120 patients a day, whether at the tent or respiratory clinic and the emergency departments in various places. Our goal is to ramp up to close to 500 tests a day, and in multiple sites. So at the current Somerville site, we historically were doing somewhere between 60 and 80 a day. We're definitely going to double this and more on the short term. And as we open other sites, we're going to ramp up testing to close to 500 a day if we can secure enough supplies. When? Within the next couple of weeks. Yeah.
A little more about the sensor and how that's protecting veterans.
Sorry, I couldn't hear. The sensor, yes.
Protecting veterans.
So the value of the sensor, it gives us continuous information, because you have 27-hour minute-to-minute monitoring of patients that have the sensors on. And our ability to make sure that we have continuous information fed through the cloud into our oversight center. And if patients hit certain parameters, whether it's through temperature, blood pressure, pulse, oxygen saturation, respiration rate, throughout the protocol, then we can call the patients in and bring them back and evaluate them and see if they need to be hospitalized.
Question for the mayor. Mayor Michael Cross, Channel 4. We're starting to see more communities implement pilots for antibody testing. Is that something that is considered an option down the road once this testing program rolls out?
Yes, we are working with partners on serology, antibody testing. I want to caution folks, there's an article in the New York Times today that spoke that in of itself is not a good measure to determine whether we should be lifting restrictions or changing course, but it's a good measure to get a handle on how the epidemic is spreading. And it's another measure. We need a series of measures. So between your acute testing, antibody, the serology, the antibody testing, the case tracing we're working on, not just with the deep, mass DPH's efforts, but we'll also, along with other communities, look at that digital tracing that's evolving. All these efforts will scaffold on top of one another to enhance our capacity to understand who is really sick, not just showing symptoms, and how to guide us more strategically about the policy decisions we should be making, not just in Somerville, but to share with other municipalities in the region and the Commonwealth.
Happening soon, or is it something down the line?
We're actually in the throes of that now. So.
How the decision came about to enforce that beginning Wednesday, and how the fine was actually came across that number, $300 fine.
Yeah, so the question was about the mask order, which we issued today, effective April 29th. Anyone 2 years of age or older must wear a mask or facial covering in all indoor and outdoor public spaces. Again, as I mentioned in my remarks, we're doing everything we can to interrupt the transmission of the virus. That is our responsibilities. By doing that, we maintain the stability of our healthcare system, and we obviously avoid people getting sick, and we save lives. So as part of our monitoring, we had an advisory out there. Overall, I want to thank the people of this community for doing their part to help us take on COVID-19 and get our arms around this crisis. And I know this, and these types of decisions are disruptive. They're unusual. They can be abrupt, but they're absolutely necessary. So much of what we're doing isn't about making people comfortable other than connecting them to essential services and needs, such as food and housing and shelter and medical attention. But our decisions here have to be done in a way that interrupts this virus from expanding any further, getting people sicker. We don't even know all the people who are sick in our community. The fine is simple. We fine people in general. If you do anything, any of our actions or conduct that jeopardizes the health or safety of anyone, there's typically some sort of law, regulation, or fine associated with it. We even pull over bicycles who do not ride in bike lanes or on sidewalks. So we have a responsibility to make sure we have compliance here. But I want to make clear, that's why there's a grace period. We are hoping for compliance. We'll continue to educate people for compliance. We are seeking greater distribution of more masks and supplies and connecting people to how they can actually make their own covering out of cloth. And we're going to be, policing this with compassion. Our police department is trained in compassionate policing. We'll be out there educating, in some cases handing out masks if people don't have them. But for those who willfully do not want to comply, it'll be necessary that we have a fine as a proper deterrent and to force compliance. Because at the end of the day, it's about keeping people safe, not allowing people to become ill, and saving lives. Any other questions?
Little off topic, but grocery workers today at Stop and Shop in their union sent a release saying that they want to be classified as first responders to get access to emergency child care and faster testing. Do you have any thought on that? You feel like that's a good move by them? You would, City of Somerville stand behind that?
So I stand with our grocery workers. They're at the front lines of providing us an essential service, and they're becoming ill, and we know some of them have actually died. And they're out there working a job because, one, they're trying to help us. They're trying to make sure we're kept fed. They are providing an essential service, let's be clear. And many times they're doing this without regard for their own health and safety. So we should be doing everything to elevate their service as being essential, providing them with the necessary supplies and equipment to keep them safe. Any other, Mary?
What kind of fine are you talking about if you're caught not wearing a mask?
It's $300 fine.
Okay, and also back to the veterans' homes. Can you get us some numbers on, positive tests there to date, and just the sensors? How many, are most of the veterans being, given sensors, or is it just a certain population? Or?
Well, the veterans, I'll leave it to Cherish and folks. It'll be to the folks at the Mass Bay housing we have on the west side of the city. How many is that? 22 veterans will be part of this pilot program. And the number of, I'm sorry, Mary, was that the number of positive cases in Somerville? What is our case level right now? Yeah, so 581 positive cases. We've had, unfortunately, 6 fatalities, and how many recovered? 178 recovered. So about a third, or actually less than a third now, recovered. And we've had 6 fatalities, sadly. No, not in the veterans home. We have been extremely fortunate. We've implemented measures. Last week, we implemented measures, and first we distributed 4,000 masks to all private and public housing developments for veterans, for seniors, people with certain disabilities, and all these residents are required now to file with our Board of Health a site safety plan outlining their procedures for sanitation, for safe distancing, social distancing, and for resident safety. So seeing those reports and those horrific stories around the country of nursing homes, assisted living facilities, veterans homes that have, where so many people have died, we've tried to take early action on this, and we've been very fortunate so far.
Positive cases at the veterans home, at the Mass Bay veteran?
0. Yeah, 0. Sure. We'll have it out for you. Are there any other questions? I'll step out.
So this is it's a wearable biosensor. The device works just like a bandage. You peel off the backing, and as you peel off the backing, which is usually easier to peel off, there we go. You peel off the backing and you essentially place it right above your heart on the left side of your chest. What the sensor then does is it's got all these pickups, these sensors on the back. They look sort of like EKG leads, things that you normally would stick on to do an EKG. And that's actually what they are. So there are 4 of those pickups. And then in addition, so those 4 pickups pick up your heart, the actual waveform of your heart, and they give you a continuous EKG, and they also give you your heart rate. That data is then used to also determine your respiration rate, because this device also has an accelerometer on it. And then it also has a temperature sensor, so it measures your surface temperature as well. The data from the accelerometer is available to us to develop more and more interesting things to sense and detect. So within the context of COVID, we've got our data scientists right now working on building the AI to be able to detect from this thing, as you're wearing it, whether you're starting to cough more frequently and the intensity of your coughing, if that's starting to increase, right? So that's another one of those early detection capabilities in this thing. The sensor, the accelerometer was originally, we put it there as a platform to build additional types of capabilities like this, but originally its intention was to detect falls. And so it does that in addition to all these health conditions that we're measuring, that we're biosensing. Other questions?
Thank you very much, folks. Appreciate it. Thanks for coming up. Be safe.